Good evening and thank you so much for joining us on this episode of Family Matters. My name is Purity Musel and it's glad to have you tuned in tonight. We just want to have a look at how well we should be taking care of ourselves during this festive season. And to guide us with that discussion is Dr. Rudi Eggers, who is the World Health Organization's representative to Kenya. Thank you so much, sir, for joining us. And once again, sorry for the delay with the show. We apologize for keeping you. Yes, all right. So let's begin with the latest. We have received reports confirmed by the World Health Organization that there is a new strain of coronavirus reported in the UK. Maybe you can let us know the development about this new strain.
So indeed, it's quite new information. So the new strain was reported to the World Health Organization just recently, although it seems to have been circulating for a while. It is located mostly in the UK, although the first cases have been detected in the Netherlands and Australia and other places. And it seems as if the transmission is increased, but we don't have the full details as yet. We don't know if it's maybe because it's more easily detectable that in fact we are finding more of this virus. It does not seem to be cause more harm or more severe disease, but again, it's quite early days before we can actually say what kind of effect this variant will have. For now, the World Health Organization is in contact with the authorities in the UK to see how to get the best information out there to actually be able to inform member states of this.
And is it clear whether it may spread to other parts of the world? Again, as we saw with the coronavirus, the origin was in China. Would we say that UK is the origin for this new strain of the virus?
Again, there's not enough information. There seems to be the virus has already spread to other places, so it's not confined only to the UK. And in fact, it's likely that it will spread to other places because, of course, the virus probably has been circulating for a while. Even now, we are detecting and noticing it, that it actually is more easily detectable. So it's quite likely that actually it has already moved beyond the United Kingdom.
And would you, as a WHO, link this new strain of virus to the second wave of infections and third that is being witnessed in some parts of the world?
I think it is separate from that. So I think the waves that we're encountering mainly in the Northern Hemisphere, but also in South Africa and other places, are really a product of the way people have become complacent with the measures that we have against the virus. And in fact, we probably know that 4 out of 5 people are still susceptible to this disease. Even here in Kenya, those numbers are quite high still. So actually we should anticipate that further cases will actually occur in Kenya, in the rest of the world, because there are many, many people that are still susceptible to this disease. But that is irrespective of which variant you're talking about. It really is not dependent on the variant. That further waves will come on as people become complacent and not follow the guidelines properly.
Is it too much work for the UN health body that you are still doing research on the COVID-19 disease, and now we have a new strain of the coronavirus? How are you dealing with this?
I think that is what the World Health Organization is there for. It's meant to actually bring together the information, the best information from across the world, consolidate that, get advised by the experts. So WHO actually convenes together the experts from around the world to actually understand better what the disease is doing and what the virus is doing. And that is really what we are there for. Sure, it's been a very intense year, but I think it's been a very intense year for everybody. Everybody's been feeling the strain of this pandemic and how people need to interact with each other. And really the World Health Organization is meant to really push the agenda forwards to make sure that we can protect as many lives as possible, protect especially the most vulnerable, the elderly, those with comorbidities.
Right, and almost a year on since COVID-19 was reported in China, there were reports it could be airborne, not airborne, social distancing is working, put on the mask. Do we have now enough information on how this disease, COVID-19, could be prevented?
Well, I think we're learning all the time, and in fact we are learning that things like the mask and social distancing actually work quite well. They are actually quite effective in actually providing the protection that we need. So while in the beginning we were not quite clear how best to control this disease, this is now becoming much more clear. But day by day we're learning new things. We're learning how the disease spreads. We're learning how to interact with each other. Things like in Europe they're looking at ski resorts now, how to interact there, how to be safe here. The second wave has taught us a lot of things about immunity and how people still remain susceptible even while the disease has already ravaged the country.
Still on information about the coronavirus immunity, do we have anything about concerning immunity, especially when people test positive for COVID-19? Are we seeing immunity on their part, or are there cases where they could be reinfected?
We don't have any clear information about reinfection as yet. So there have been some cases that have tested positive and then negative and then positive again. But that may be a feature of the way that testing actually gets done. The PCR test is quite sensitive, and even if there's some genetic material left, actually the virus can be redetected. So as yet we don't have information if there truly is a reinfection going on. From the information that we're getting from the vaccines, it actually seems that there is a protective value in the immunity. So it seems to be a ray of hope that actually, in fact, the immunity might be present and might be protecting the people.
Right. Globally, so far, over 76 million people have contracted coronavirus, and about 1.7 died from the same disease. The cases are increasing day by day, and we have, as the world, not been able to control the spread of the disease. Does this have anything to do with the behavior of people, or still it's on the preventive measures that have not been clearly, understood?
I think it's very clear that the behavior of the individuals really plays a big role. So obviously, as the climate has become colder in the northern hemisphere, people have come together more in enclosed spaces, and that's where we've seen the rapid rise of cases and of deaths as well. And this has really been the driver. The action, how people interact with each other, really is the main cause of how the epidemic has spread. We've also seen some celebrations go on in some of the northern hemisphere countries, but also in South America and South Africa, etc., that have really caused what we call super spreader events, where a lot of people congregate without protecting themselves properly, and then suddenly many people being infected at the same time. And this is really maybe also a warning for a place like Kenya, where in fact we're going into the festive season now, and in fact people might feel, well, we've been constrained so long for the whole year, it's time to celebrate. Well, in fact we're seeing this celebration, this going out and not following the guidelines actually is quite dangerous.
And how would you describe what is happening in Africa? Still, cases are not as much as what we're seeing in other, continents. Do you still want to say it's because we have not ramped up the testing capacity here in Africa, or the virus is not so harsh on the African countries?
Again, it's a thing we're learning still. Truly, we haven't got the testing capacity like the rest of the world, so that is still a factor. So if you look at the figures, the proportion of the population tested is lower in Africa. At the same time, we've got experience in South Africa, of course, which was 5th highest in the entire world at a stage. So in fact, the disease does also come to Africa. Thankfully, it has not been as fatal in Africa, so we've actually had much less fatality in Africa. Only 3% of the global deaths have actually occurred in Africa. Why that is the case? We've got a younger population in Africa. There might be some other immunity components that are at play, but this is part of our learning. It's still not firmly cleared up why that is the case.
And from your own evaluation as a health body back home in Kenya, how would you describe Kenya's fight against this pandemic and most importantly our curve, because in the last 24 hours we had 349 more people testing positive from only 5,000 samples tested.
Yeah. So in fact the curve currently is declining again, so we're having less cases this week than we had last week. So that's maybe good news, but again, also the testing has declined. So as the testing kits have become less, the laboratories actually have geared down the operations over the holiday period. Some laboratories have stopped actually testing altogether. And this is part of the reason, in fact, why we are not seeing as many positive cases. So we truly cannot differentiate between, is it a reduction of the transmission of the disease, or is it a reduction of the testing that is causing it? It feels a little bit like we had in August, when there was also a decline in cases, but there was also a decline in testing. So at that stage, people were also feeling, well, maybe we finished with the first wave and things are okay again. It feels the same way. I am fearful that actually we will actually have another peak as people come out of the festive season, maybe infecting more people.
Right. And allow me to ask you this. Do we have, because most of the people, especially in Africa, who test positive for COVID-19 are being isolating at home under the home-based care program. So do we have recommendations on how to care for these patients? Because most of them are left alone, and during the first week of this struggling with the disease, I actually had the virus sometime in October, and so it's a bit tough that you have to stay alone and your family members are not even aware how they can take care of you. How do we care, according to WHO, for COVID-19 patients?
In fact, both WHO and the Kenyan government, the Kenyan Ministry of Health, have got very clear guidelines on home-based care. I think what maybe can be done a bit better is the informing of the people that are directly taking care of the person that is tested positive. So while there are general guidelines that are maybe written in a way that expressed towards health workers or to social workers, maybe we could have done a better job to really inform the family members on how best to actually help those that have tested positive. In fact, I think Kenya has been quite successful in the use of the home-based care. Wherever it was possible to have people in a separate room or a separate environment. And for many, that has really been also a saving grace, because going to hospital for all those patients would have been quite overwhelming for the system. If you look at the numbers, there were thousands of people that were treated in home-based care that could not have been treated in the isolation centers or in the hospitals.
All right. And do we have hope to successfully fighting the coronavirus pandemic as we end the year? Because we've seen some vaccinations being introduced, especially at the US. Let's talk about this and the efficacy of these vaccinations.
So truly the vaccines are a ray of hope. So it seems that the efficacy is quite variable, between 70 and 95%. Different vaccines that are being produced have got different ways of working. And just to be clear, that the numbers that have been tested are still quite low. So some of the vaccines have been tested on 40,000 people, which sounds like a lot, but in fact it's not that many. So in fact we'll be learning a lot more in the next period as people get vaccinated in large numbers. And they get evaluated afterwards on how effective this is. So the initial efficacy seems quite hopeful, and in fact we should really see this as a way forward for Africa, for the rest of the world, to actually ultimately deal with this disease, because that really is the only ray of hope that we have at the moment.
And from where you sit representing the WHO here in Kenya, when do we expect to begin having these vaccinations? Because we really need the vaccines in the country.
WHO announced yesterday, in fact, that they had secured 2 billion doses for the so-called COVAX facility. Kenya is one of the countries that have applied for vaccine through the COVAX facility, and our understanding is maybe by the end of March that we would be getting the first vaccines in the COVAX facility. The Kenyan government has also announced additional doses being purchased through their bilateral approaches to the vaccine companies, but that I think is also still under negotiations. I'm not aware when that will actually be delivered. So we are hopeful that by maybe March this coming year, we will have the first doses coming into Kenya and to the other countries that are applying for COVAX facility.
And let's talk more about the vaccines, because most people putting on the mask and socially distancing has really changed the lives of people, which most of them are yet to adapt to this. So will this mean putting away your mask once the vaccines arrive in the country, or let's say in every part of the world? Does this mean now people may stop using the face masks and go back to their normal lives, or what will the advent of the vaccines now mean to the fight against COVID-19?
So it won't mean that immediately you can drop your mask and immediately you can go to big gatherings, etc. You should realize that the vaccines will come in quite slowly. So in Kenya it actually will be over the entire coming year. And many people will in fact not be vaccinated. So the COVAX facility provides for 20%. So I think we should recognize that for the coming year, we will still have the mask, we will still have the social distancing for a while. Ultimately, there will be enough people vaccinated, there will be enough people that are immune. We will probably be doing away with the mask altogether. But this is not something that happens immediately when the vaccine actually is brought in. It'll take a long time, a year even, before that actually comes to fruition.
And you've highlighted some of the super spreaders events, especially when people come together during celebrations. And here we are headed to Christmas next week and of course New Year's celebrations. So how big of a threat are these celebrations to the fight against COVID-19?
They can be quite a big threat. So let's be very clear about, it's really about how people act. So there's the personal side, the wearing of the mask, the washing of hands, the social distancing. So each individual actually has to comply with those individual guidances on personal behavior. But there's also the community, so avoiding crowded places, be it religious places, be it entertainment places, be it New Year's celebration, whatever it is, the crowding is a problem. Enclosed spaces, so enclosed rooms or bars or churches, anything that is enclosed. And then confined, many people coming together in the same place, crowded places are the big area. So all of these things are in place in the festive season, and that's the way we used to have our celebration. This year we really plead with people to be very, very careful. Think about not only yourself and this hard year that we've had, but really that we are not past. The virus is not sleeping, it's not going on a holiday. It will continue to infect if you continue to let it infect people. So as such, it really is a plea for this festive season not to become a super spreader event. Because if truly the health system gets overwhelmed, we really are in a very dire place.
And how would you think that people should behave during these festive seasons and have, if possible, safe celebrations?
The first thing is, I know that a lot of people travel up country. I think this is the year where we should ask the question, is it necessary? Is this travel necessary? I feel very strongly, I know people want to be with their family, they want to see maybe their parents or people that live in their upcountry homes. But this is the year where really that question should be on the table. Is it necessary really to travel for your own protection and for the protection of the people back home? If you do have to travel, let's be very clear that we comply with those requirements. In the course of the transport, of course, we know that a lot of the infection may take place in the situation of a crowded transport or crowded bus stops or matatu stops. But then also the wearing of masks. A lot of people wear it under the nose or under the chin, just a basic thing like that. Just comply with the existing regulations would actually make a big difference already.
And in case it's necessary to travel up country, what are some of the precautions that you advise people to take?
The precautions remain the same,
yes.
So that hasn't changed. The masks, the hand washing, the social distancing are the same. So let's, I think, reinforce that. I think people have become complacent. They maybe feel that they can take off the mask if they are at home, etc. And that really is not the case, especially when you are traveling from one country to the next. The mask really is necessary. And let's not forget, it's not only for yourself, it is really also for the person that you are meeting that mask is important. And then those 3 C's, avoiding the crowded, confined, enclosed spaces, that really is our main message at the moment. In the celebration mode, people coming together in enclosed spaces are really problematic.
And some countries have already imposed restrictions during this festive season. Case in point, Kenya, the curfew still remains, and other regulations. But do you think that countries should impose, like they had earlier on, travel restrictions to their citizens?
I think the restrictions have to be reactive to the actual data. So as cases fluctuate, as they get more or less, it's up to the decision makers to actually look at that data, look at the reasoning, the interpretation of that data as well, and from that make the right conclusion. So what we've seen in Europe, of course, is the effect of winter, of people being confined in close quarters. Here in Kenya, I think we should be awake to the situation and really constantly ask the question, are we doing the right thing? This is obviously for the Ministry of Health and the decision makers to make those decisions. There's also economic and social aspects that need to be taken into consideration. But ultimately, let's look at the data, let's look at the science and make appropriate decisions. At the moment, of course, Kenya has decided not to actually restrict travel. So for now, as far as I can see, people are doing the travel to upcountry homes. So it really is also up to the individual to make that personal choice if they want to put that risk to the relatives and to themselves.
And in the process of making the personal choice, most people will think of taking a COVID-19 test, and if the results are negative, then they are free to go home. So let me ask you, is a negative result enough to travel up country?
So as far as I know, there's no requirement for any testing to take to travel. So obviously when you do international travel, the airline will request you to do a negative test. But for in-country travel, as far as I know, there's no requirement. You can do it for your own assurance, but let's be clear, that is a reflection of your status at that moment. It just basically says at that moment you don't have enough genetic material of the virus in your body to actually show positive. You could infect within a day or 2 afterwards. So even having the negative test today, 2 days later, you could potentially be positive. There is some reassurance in it, but there's no requirement as far as I can say. So to me, much more important is really that mindset, the mindset of let's be careful, let's be protective of each other.
And from the WHO, do we have new guidelines during this festive season, or it's basically what you've talked about following this, saying that the guidelines have not changed?
So from WHO, we're reinforcing the avoid 3 C's, the crowded, enclosed, close contact. So that's the main message at the moment that we're trying to get out. It's quite similar to what has been said before, so it sounds as if it's really the old story, but let's focus on that. Over and above the personal choices, that focus on how we gather, how we come together is really our main message at the moment.
And there's something we had talked about on caring for COVID-19 patients, and someone here is asking that, so if a relative is contracted COVID-19, how do we take care of them, especially if they are too weak to cook for themselves? Should they still continue living alone?
So that's a fine line, and really there should be contact tracers and people that support the home-based care in the counties where the people are. So there should be a mechanism of assessing if that person truly can be taken care of at home. If the situation is such that either the home situation cannot allow for proper isolation, maybe people are living together in one room, or there's no proper means of isolation, or if the person themselves have become too sick to take care, then really they have to go to an isolation centre by the government, or in fact a hospital. But there should be advisors that actually can tell them that. So the people within counties have been trained to actually be contacted and then assess these people what should be done in terms of home isolation versus government isolation.
And there's a lady asking, is wearing of masks and socially distancing enough way of protecting yourself from COVID-19? And when, I think it's two questions in one, and once one contracts the disease, should they be blamed that they were careless for contracting it?
So the first thing is, you can never say it's enough. It is very, very important. So let's get that message out very clearly. It is very, very important to wear the mask, to socially distance. There can always be infection. So even the mask that I'm wearing, there's possibility for the virus to enter. It will protect against 90% of droplets, but those 10%, it's possible. So the second part of the question is, should we blame people? No. This is really, really important that if a person gets infected, we cannot just say, you've been careless, therefore you are infected and you should be blamed for it. In fact, everyone, you and I, you said that you had been tested positive, can actually get this disease, even with the protection that we take. I'm quite careful actually and even I can be infected. So let's be very careful that if a person tests positive, let's not blame them, but really approach the subject with a lot of compassion. Because we also don't blame people for getting malaria. I mean, it's the same kind of thing.
All right, there's someone who sent me a message on my inbox.
Yes.
Maybe they do not want their identity to be revealed, but they're saying, I tested positive for COVID-19, but when I recovered, still colleagues treated me like a COVID-19 patient. So this person wants to know whether once they test negative at least twice for COVID-19, are they at a risk of spreading the same disease? Should they still isolate? There's that confusion with this particular viewer.
So no, they are no longer infectious. If they've tested, as they say, twice negative, they're no longer infectious. In fact, the WHO guideline is if the person is asymptomatic, 10 days after that positive test, they are no longer considered to be infectious. So they should really be allowed to go back to their regular work, to their regular family in that context.
All right. So as we wind up, I'll welcome your message. What's your message during the upcoming festive season to any person watching out here? You had said that if necessary, you may ask yourself if it's necessary, but as an expert, what is your message? What should we do during this festive season?
I think my main message is that we are all feeling tired. It's been a really tough year. Everybody feels they need a break. They need a rest from this very difficult time. But the main message is the virus is not resting. The virus will continue to infect, and it seems in some parts of the world it is accelerating to infect. So the virus is not resting, is not taking a holiday. So even while we know people have become tired, let us not take a rest from those things that protect us. So the mask, the social distancing, the hand washing, the avoiding crowded places. it feels awkward to say it again and again because people don't want to hear it anymore. But because the virus will not stop, we must continue. The ray of hope really is we will hopefully get vaccines, there will be immunity in the population, and we will get back to a more normal life. And I think that's what we are hoping for. So the message at the moment is the virus doesn't rest. Please don't rest your protection measures.
The virus does not rest. That is a message, even as we look forward to celebrating the Christmas and New Year's next week and next week, but one respectively. Dr. Rudi Eggers, thank you so much for making time for us. It's always great to have you on this particular show on Sundays. Thank you once again for your time, and Merry Christmas and a Happy New Year.
Thank you so much.
All right, thank you so much. And that has been Dr. Rudi Eggers, who is the World Health Organization's representative to Kenya, just talking about some of the precautions that you ought to take if you have to travel up country for the festive seasons. But remember, the virus does not and will not go on holiday. That's a message from Dr. Rudi. Thank you once again for watching Family Matters tonight. My name is Purity Museo, and Simon Caro, the has been our sign language interpreter tonight. Do have yourself a lovely night and week ahead. Take care, stay safe, wash your hands, put on the mask, and socially distance if you can. God bless.